Also done clinical assessments in pre-market trials and have provided industry feedback on what we think has potential and what may not. This aligns with my view that Periodontologists and the needs of patients should be driving development of devices and pharmaceuticals and not coming up with a problem to fit a solution. I feel like we're done with that backwards thinking, and I'm excited for this particular study and how we can translate those findings to patient care.
Awesome. Thanks, Dr. Clem. While you mentioned it, just some more background information for the audience listening. Could you briefly describe the purpose and the design setup of this study?
Sure. So with regard to the study itself, we wanted to compare a volume-stable collagen matrix fiber guide with an autogenous connective tissue graft harvest for soft tissue augmentation around existing implants. For those of us who followed our patients as they age, we frequently see facial dimensions of bone and soft tissue decrease around implants. This thinning, particularly of soft tissue, can result in aesthetic issues, discomfort in function, difficulty achieving hygiene maintenance, as well as even simple probing. We wanted to try and assess both the clinical and patient outcomes in terms of traditional endpoints. The traditional endpoints that we looked at was thickness of tissue, probing depths, as well as patient-reported outcomes in an unbiased manner as possible.
Sure.
Our primary outcome was soft tissue thickness changes 3 millimeters below the gingival margin, with secondary outcomes including keratinized tissue width, probing depth, pink aesthetic scores, and patient-reported outcomes.
Great. Dr. Clem, this was no small study by any means. There were over 60 patients. I know about half, 31, received Geistlich Fibro-Gide and half received CTG. Can you just discuss, and there was the specific focus of soft tissue thickness over the course of a year. Can you just discuss some of the outcomes of that and what the study found?
Sure. So, pardon me. So, given the inclusion criteria that we had, which was soft tissue augmentation around existing implants with some evidence of keratinized tissue and minimal recession, Fiber Guide provided soft tissue thickness and volume increases, which were non-inferior to connective tissue grafts. This concept of a statistical test for non-inferior is fairly new in periodontics. Most of us have grown up with the conclusions that are either significant or non-significant. But just because the procedure is a significant change compared to the standard treatment, it doesn't mean that it's clinically significant or superior.
Okay.
Nor does it usually speak to a patient's perspective of that treatment. I think the way to approach non-inferior testing, particularly in this study, is to understand that it will not test superiority. This would require huge numbers of patients and very dramatic changes. What we can say about how this non-inferior testing was applied to this particular study is that it will reveal a technique or product that is inferior to the standard. In other words, it'll tell the clinician that a procedure or product is no worse than the standard. This gives us, I think, more confidence that we can choose an alternative that does not compromise the results of treatment. In addition, once we have these non-inferior testing capabilities, the clinician can now look at other effects of the test material in determining patient-specific alternatives. In this case, the volume stable collagen matrix graft fiber guide demonstrated clinical measurements and patient-reported outcomes that were similar. However, surgery time and post-operative time were demonstrated to be less with fiber guide than autogenous harvest. We saw similar soft tissue improvement with better patient-reported outcomes. We have to remember, patients determine aesthetics, they determine tissue sensitivity, they assess their own ability to manage plaque control, and they tell the surgeon if they think the results look better. Ultimately, soft tissue thickness and volume changes were similar between the two therapies, with site sensitivity and aesthetics improving for both. But surgery time and pain in the immediate postoperative period was significantly less for Fibro-Gide. So clearly, having an alternative treatment that's less invasive, easier to use, and still effective is always something that I think clinicians value, especially in treating medically compromised and elderly patients. You know, my practice is aging, and patients' ability to tolerate more invasive and longer procedures are sometimes difficult. With this study, it gives me confidence that I have a valuable alternative, and in many cases has become my treatment of choice. So as we look at maintenance of implants over the long term, particularly in private practice, we're seeing patients now that had implants 10, 15, 20, 25 years ago. And these patients many times will have volume changes in soft tissue that reflect difficulty in managing those delicate tissues. And the choice now is to not only focus on bone, but also to focus on the quality and quantity of soft tissue surrounding the implant.
You mentioned that the patients receiving Geistlich Fibro-Gide in the study experienced less pain and quicker recovery times. I know that may be, obviously important to the patient. What do you and your colleagues take away from those critical factors that the patients are reporting?
So the issue of soft tissue around implants has to do with two factors. It has to do with health of the implant, which directly correlates the patient's ability to maintain plaque control around the implant, and also relates to our ability to periodically assess the soft tissue health with simple probing. With patients, if they have an alternative where I can take, and some of my patients now, when I started in practice, my patients were 40, 50, and 60. Now they're 60, 70, and 80, and some of them are in their 90s. And they're coming into the practice with these soft tissue declivities and compromises. And if I can take an 85-year-old patient or an 80-year-old patient and provide them a treatment alternative that is less invasive and easier for them to tolerate and still get the results that I'm looking for, this is something that I think is going to grow in our practice. Now we're really into minimally invasive procedures, and that relates to all patients. So I think it's independent of age, but in our practice, we see that middle to later decades in life, and patients that are medically compromised. These are the patients that are really going to make up our practice in the future.
Fantastic. Dr. Clem, I don't want to take up too much more of your time. You've been so generous with it. Before we wrap up, could I speak to that clinician, Dr. Clem, as opposed to the academician or clinical trial doc I also know? Is there anything in parting words you could say after your experience with this study or your experience about Geistlich and Geistlich's Fibro-Gide that you'd share with your colleagues, not only in the US, but around the world?
Sure. So I think, in terms of handling the material is pretty thick. It's about 6 millimeters thick. And what we found over the course of using the material is placing the material dry with its full thickness intact, up to 6 millimeters in the center, with the ends beveled, seems to improve thickness outcomes, as we did see shrinkage of the material over 6 months. Starting with wide full papilla accommodated the suturing and I think added flap management. The less tissue you begin with, the less change you're going to be able to achieve.
Okay.
Our inclusion criteria required a minimum of 2 millimeters of keratinized tissue preoperatively, and no recession resulting in the exposure of the implant body itself. So it's important to remember that case selection is key.
Fantastic. Dr. Clem, thank you so much for your time. This study is so important. Thank you for your work. Thank you for sharing your time with us. It was great, and we love having you on talking about regeneration. The study itself really shows the evolution of regenerative therapies and how the advancements are taking place. And that's what Geistlich is dedicated to. So we thank you on behalf of the company and the field itself. You're really evolving regenerative science. And for more information, everyone listening to this, please visit geistlich.us. You can read more about the Fibro-Gide product, as well as get links to the study and just get smarter on what advancements are taking place in regenerative science. Dr. Clem, thank you so much. We really appreciate it.
Well, thanks for having me. It's a pleasure talking about a subject and a field that I've become very attached to, no pun intended.
Well, good. I hope we can call you back up and have you as a repeat guest on talking about regeneration. You are awesome.
Appreciate it. Thank you.